Good morning everyone. I'm Dr HARITHA K H and today I'll be presenting continuation of section 1 of Reading Club based on MISH Contemporary Implant Industry conducted in association with International Implant Summit 2026. Let's get started with chapter 4, Bone Physiology, Metabolism and Biomechanics. Differential osteology of maxilla and mandible. Although equal and opposite functional loads are delivered to the maxilla and mandible, the maxilla transfers the stress to the entire cranium, whereas the mandible must absorb the entire load. Implant-anchored orthodontics. A major problem in orthodontic and facial orthopedic is anchorage control. Undesirable movement of anchorage unit is a common problem that limits the therapeutic range of biomechanics. An important application of basic principles of bone physiology is the use of rigid endosseous implant for orthodontic and orthopedic anchorage. Animal studies and clinical trials of custom orthodontic devices have established that rigidly integrated implants do not move in response to conventional orthodontic and orthopedic forces. Routine use of rigid implant for prosthetic or orthodontic application require that fixtures are placed between or near the roots of teeth. Inadvertent impingement on periodontal ligament and the root of adjacent tooth still may provide an acceptable result. Cementum repair occurs where the root is cut, the periodontal ligament reorganizes, and the implant surface is integrated rigidly with osseous tissue. No evidence exists of ankylosis of the teeth. Moving on to Chapter 5, Biomaterials for Dental Implants. In the 1960s, dental implantology as a clinical discipline was judged by some to be rather disorganized, and treatment provided were often said to be not as successful as hospital-based orthopedic and cardiovascular surgery procedure. One part of this opinion related to the use of standard intraoral dental materials for implant plus general dental operatories for surgical activities. The biomaterials discipline evolved rapidly in 1970s. Successful use of synthetic biomaterials have been based on experience within the field of dental implantology. The basis for many of the newer and more clinically successful surgical reconstructions evolved within dentistry, with some now recognized as the most successful type of musculoskeletal reconstructive surgery. The biomaterials discipline therefore has evolved significantly since 1990s, and the synthetic biomaterials are now constituted, fabricated and provided to healthcare professionals as mechanically and chemically clean devices that have a high predictability of success when used appropriately within the surgical disciplines. This chapter on biomaterials has been separated into sections related to bulk and surface properties of biomaterials, and emphasis has been placed on the published literature on how these biomaterial properties relate to interaction and tissue interface. With that, we come to the successful conclusion of this insightful section. Thank you.